Good morning, everyone. Should I start the training?
Good morning, Dr. Neha. We are just waiting to join our MD, Mr. Fatigue Room, and
Oh,
as soon as he get joining, we'll start the session.
sure, fine. Thank you, Mr. Bimal. Thank you.
Hello, good morning, everyone.
So, Dr. Neha, we can just start the session now. It's okay to go.
Right. All right.
Thank
Thank you
you.
so much. Thank you, Mr. Bimal. So, good morning, everyone. I am Dr. Neha, and I'm going to take your session today for the first aid and safety, right? I'll just like to introduce ourselves. I belong to and represent Dr. Safety company, right? And We are a leader in safety services. It's been a leader in health, safety, and disaster management. We have trained more than 1 million people and we serve more than 1,000 corporates. And today, our topic of discussion is advanced first aid and CPR and AED trainings, right? So I'll just let you share a few things that, see, this is going to be an interactive session, right? I'll first of all let you know the things, but if you have any queries, you can always raise a hand. And please keep muted yourself till I ask you to unmute, right? I'll be so thankful for your cooperation. So do you think there is a need to learn this first aid and CPR? Can anyone answer? Do you think there is a need to learn this first aid? Sorry.
Yes, yes, definitely.
Why? Why to learn it?
Because
Yeah, because
we can help ourselves and help someone in emergency.
absolutely, we can help others and we can help ourselves also, right? So there are few things which we have to, like in module 1, I'll be teaching you. The first is 3P formula and how to call the emergency services. Please mute yourself, please, right? And a few things like introduction to the first aid box and breathing ratios. So now first thing is, whenever you are giving a first aid to anyone, we always should try as a first aider that we have to save the person's life, right? We have to preserve life of that person. First, second thing is, we should not increase his or her suffering. So we have to prevent further harm. If we don't know how to tackle a heart attack, or how to tackle a fracture, or how to how to go with the first bleeding, so don't intervene, right? Just stay calm, call the first emergency medical services, which is also considered to be a kind of first aid, right? So you have to preserve life, prevent further harm, and we have to promote recovery of that patient. Because see, whenever you are giving a first aid, right, to anyone, or you are helping someone, we always have to promote recovery, right? The thing is that we have to save that person. So 3 P's are very important for a first aid: preserve life, prevent further harm, and promote recovery. Now, the thing is that if you are going to call on emergency medical services, first of all, whatever you have to tell your name, your phone number, your location, your number of victims, right? And what happened to the victims. Like suppose a bus of small children have has a fall from the mountain, right? Now, you have to tell that uh, the, like when you are giving a call, you have to tell this I am calling so and so, right? And my phone number is this, my location is, like I am calling from like a landmark, right? Like if you are in Shimla, you have to tell that I'm calling from a ridge road, right? Then you have to tell that this is a bus which has toppled up. There are 16 children, from which there are 8 female and rest are male, right? There is one teacher, so that the ambulance or the people should be come prepared for the approximate that what has to be done for them. So that is why you have to give all this to the emergency medical services, right? So whenever, like, you have seen a first aid box, right? We all have it in cars, but we don't keep them up to date, right? Or what we do is that we don't uh, change the things time and again, right? Because in medical, the everything has an expiry, right? So you have to check your first aid box every now and then. Like, you have to keep the gauze rolls, triangular bandages, crepe bandage, band-aid, micropore tape, right? These are all kind of tapes and bandages, right? Then there are gauze pads, thermometer to check the temperature of the body, right? Foldable scissors, safety pins, splints. I'll let you know the splints, how they are helpful to us, right? Distilled water bottle, pencil, torch, gloves. Because gloves is very important because we don't have to come into the direct contact of any body fluid of the person, right? Because it can lead to blood-borne diseases. Can anyone tell which is a blood-borne disease? Anybody knows what is a blood-borne disease? Blood-borne diseases are like,
Septic or infections.
but what is the name of the disease?
It's a
HIVs,
hepatitis.
HIV, yes, right?
HCV,
And HCV,
HBV.
very good. Absolutely. And then from the sputum, we can cause tuberculosis, right? Which is also communicable. So if gloves are not available, how are you going to give the first aid? You won't give if gloves are not available. We have to
We
improvise,
have
right?
to improvise, right?
What we can do is we can use polythene bags, right? Or if polythene bags are not available, then you can take a cloth and you make multiple layers, right? Put it on your hands and then you have to help the victim, right? Then ice gel pack, aspirins, analgesic sprays like Move and Volini, which are available, and ORS solution, right? ORS solutions are available in Tetra packs. But now, suppose you are in a situation that you don't have ORS solution, how you can make? Does anyone know how to make the ORS solution? Can anyone tell?
Just add some, salt
Okay.
in
And
water.
Sugar and salt.
how much sugar and how much salt in what water?
Alkaline water, if it is available, or mineral water, just have to add 1 tablespoon of salt and half tablespoon of sugar.
No, no. I'll just let you know. The thing is that you take 1 liter of water, right? Boil it and let it cool down while covering it only, right? You don't have to uncover that water, right? And then in that water, right, which must be left around 800 ml after boiling, then you have to put 1 teaspoon leveled of sugar and 1 teaspoon of salt, right? Mix them well and give it to the patient. And whenever you are giving, you have to give it in small amounts, like half a glass, not more than that, right? And you have to give it at repeated intervals. Basically, ORS solution is like we have to give it in dehydration or a shock patient, right? So there are multiple things when you can give ORS solution. Now, whenever you are giving a first aid to any person, you have to see whether the patient is responsive or unresponsive, right? Now, responsive is when you just call the patient that, are you there? Can I help you? Or you can tap on the shoulder. Are you okay? You can ask multiple questions. Yes. If the person responds back, means the patient is responsive, right? Now, you have to ask that, can I help you? I'm a trained first aider. Can I help you? If the patient says yes, then you can help. But if the patient says no, then you will help. If the patient is responsive and you are a trained first aider and you want to help that patient and the patient says no, will you help? Can anyone tell me? You will not help that patient, right? You can only help by calling the emergency medical services, but you don't have to help that patient by touching the patient, right? So you just have to ask that, can I help you? If the patient says yes, only then you have to help. But if the patient is unresponsive, then we take it for granted that yes, that patient has given a consent of helping that, and that is known as implied consent. right? So if an unresponsive patient, you can always help, but if the patient is responsive, you should always ask for the help. Now, this is a breathing ratio chart. How you can estimate the breathing, and from that you can take out the pulse rate, right? One inhalation and exhalation, like breathing in and breathing out. This is one breathing, right? Breathing in and out is one breathing, right? So there are different types, different rates of breathing in every one. Like in an infant, it is 38 times. For 1 year, it is 36. For 1 to 6 year, 24. 6 to 12, 22. 12 to 60 is 18 to 20, right? Now, in 20 to 60, which is, sorry, 12 to 60, which is a standard, what we have to do is, like, you have to multiply 18 by 4, which comes out to 72, right? Now 72 is the pulse rate, or it is the rate at which our heart beats, which is the normal one. For 60-year, 20 into 4 is 80. So 80 beats per minute is the normal breathing ratio or heart rate, right? You can also, if you know the pulse rate, you can always divide it by 4 and you will get the breathing rate, right? So it is vice versa. It works both ways. Hope it is understood.
Yes.
Okay. Right. So next is how we have to check the pulse, right? For being patient, if we see that patient is responsive or unresponsive, we have to check the pulse. The pulse is always checked in the line of the thumb with 3 fingers, like this shown in the picture, right? You have to do it with your 3 fingers, distal, middle, and proximal. And you have to always check in line with the thumb. It is never uh, to the other side in the line with little finger. It is always in line with the thumb on both the arms, right? But when a patient is unresponsive, you have to check the pulse at the angle of the neck, which is known as carotid pulse. See, you don't have to remember the names, but you should only know the places and how to do it, right? So you can check the pulse with 2 fingers at the angle of the neck, which is known as carotid pulse. For an unresponsive victim, you have to check this pulse because this is the last pulse to go, right? So you have to check this pulse. Now, the normal pulse or the normal heart rate is 60 to 100 beats per minute, as shown, right? Now, this is a reading from a ECG or a electrocardiogram, right? So when the heart rate is less than 60, we call it as bradycardia. And when the beats go like thumping and in a cardiac arrest or in a heart attack, right? It goes very high, more than 120, 140. Now that is known as tachycardia, right? When the beats are less than 60, they are bradycardia. And when their beats are more than 100, they are tachycardia. You might have heard it in hospitals, or sometimes people say ki my heart beats very like increasingly, and it is known as tachycardia, right? For monitoring heart, we have multiple tests, right? The basic test is the ECG or the electrocardiogram. If a person is suffering from any kind of heart disease, right? Or if a person experiences pain in chest, right? ECG. Then there is uh, echocardiography, and one more test is done, which is known as Holter monitoring test. Holter is a painless procedure, which is like a portable ECG, right? But it records ECG for 24 hours, right? If you are having some trouble from many months and your doctor or like needs a 24-hour ECG. So a Holter test is done. In this, what is done, that electrodes are attached to the chest, right? And a monitor, which is in this shape only, right, is attached to your body. But when you have to, when you wear this monitor, you don't have to take a shower, right? And but you can do your daily activities, and it will record all your activities and symptoms for 24 to 48 hours. What kind of heartbeat is shown, like when you travel, when you get, if you're driving, you get under stress due to traffic, right? What your heart, how it runs. So everything is monitored in this Holter test. Then this can be analyzed by the doctor. Same, I'll just let you know, there is one more test, right? In this female you can do see, which is age 62 years. A trop T test is done. Trop T test is done to see the status of the heart, right? Suppose a person gets a heart attack, right? Or the person experiences it, but or she settles down. So after a span of 2 to 3 hours, you can do this test, which is known as TROP T test, right? This is a kind of blood test done on this strip, right? And you can just put blood. It is obviously done by labs or doctors. You cannot do it, but yeah, you should be aware that what kind of tests are done, right? So a trop T test can be positive after around, you can say, 16 to 17 hours of having a heart attack. Now, I'll just let you know a few things, that is what is angina, heart attack, and cardiac arrest. See, when a person feels chest pain and dyspnea, that is known as angina, right? When a person is experiencing discomfort in the chest, which is chest pain or angina in scientific language. But when a artery is blocked, like there are three major arteries of our heart, right? When one of them is blocked or two can be blocked, the person experiences heart attack, right? But when there is no pulse and no breath, and immediately the heart stops, which is known as cardiac arrest. Arrest means death, right? So cardiac means cardiac heart is arrested because no blood is flowing through it. So that causes no pulse and no breath, right? So heart attack has many reasons, right? There can be 100% blockage or there can be 70% blockage. You might have heard it also, right? Now, this actually happens as or then when a calculation of cholesterol and triglycerides causes thickening of the arteries, right? Like suppose your arteries are normal at the age of around 16, you can say, right? But if you take too much of oil and don't do any exercises, right? So what happens, that whatever oil you consume, and it started accumulating under your arteries thick and makes them thickened, right? And due to the thickening, the passage of the blood flow, it becomes narrow, right? And causing blockage, and which leads to heart attack. The very common symptoms of heart attack, which we might confuse with indigestion, right? And mainly we confuse it with indigestion. The first symptom is when a person says that I'm not feeling good, my stomach is upset, I have to go to the washroom frequently, right? And sometimes unexplained kind of anxiety, right? The person might be, it can be an alert or alarm that yeah, this there can be in further time there can be heart attack, right? Then irregular heartbeat is there. Sometimes this patient faints also, right? And patient also experiences a kind of fatigue, that there is a fatigue in the legs, there is fatigue in the arms, right? Then there is nausea and vomiting. cold sweat. That person is saying that I am feeling perspiration on my body, sweaty, right? But still I am feeling I'm not comfortable basically, right? Shortness of breath can be there. There can be pain. Now, when there is pain, sometimes the pain goes to the left arm, left jaw, left scapular region, means left shoulder, and even jawline, right? But this isn't very sometimes significant that the pain will definitely travel. Sometimes it is only restricted to the area of heart or in chest. Yeah, but many people confuse it with indigestion, right? So when there is little bit of chest discomfort, indigestion, anxiety, right, you should consult a doctor. Now, whenever there is heart attack, you have to make the person sit in this position. This is a W position for heart attack victim. Why? Because in this, the heart is at the resting position, right? And the heart has to less work for the pumping of circulation. The lower limbs are nearer to heart. So this position is made and the person is like um, we take that patient in this position to the doctor. Now, how we can take care of our heart, right? Now, first of all, the things which have to do, which makes the heart healthy, is walking, yoga, eating fruits and vegetables, right? Zero oil and plant-based diet and healthy cholesterol, right? But if you are taking too much oil, it will increase cholesterol, triglycerides, affecting your heart, leading to high BP, right? Then if your intake of sugar is high, again it's going to affect your heart, leading to obesity and stress, right? So what you can do is like magic tea. Whenever you are feeling your stomach is feeling empty, take a sip of tea and bite something, right? Don't keep your stomach empty for long hours. Brisk walking, which should be done for 45 minutes in a day. You know, whenever a person undergoes stenting, like angioplasty is done, the doctor recommends him or her less of milk and more of walks, right? You should at least do a 5 kilometer walk every day. But if you can't do it in one go, you can break it into two. Like 2.5 you can do in the morning and 2.5 you can do in the evening, right? Avoid oily foods, fruits and vegetables. In bulk, you should eat. Avoid animal foods, that is non-veg, and decrease your LDL. Now, as I told you, we can uh, we can go for a heart checkup or we can see our heart health through this. We have to go a lipid profile. As I told you initially also, a treadmill ECG is done. Then we can go for echo and then treadmill test. This is lipid profile, ECG, echo, and then treadmill. This is like 1, 2, 3, and 4. These 4 tests are done. If they are found something, then angiography is done by your doctor. And for that angiography, if blockage is found, then stenting is done, which is known as angioplasty. Right? You should also monitor your blood pressure. Now, blood pressure is the type of a alarm which is set in our body, and sugar levels. These two are very important to monitor. Now, the normal blood pressure of a normal person aged between 12 to 60 is 120 by 80. 120 is the upper, which is systolic, and 80 is the diastolic BP, right? So 120 by 80 is normal BP. But any deviation from it, maybe lesser than 120 by 80, that is low BP. And if it is more than 120 by 80, like suppose it is 130 by 90, it is considered to be a high BP. But only one value of 130/90 in one day doesn't make you a hypertensive patient, right? Or 110/70 or 110/60, just one reading doesn't make you a hypotensive patient, right? So we have to, if you have to be declared by a doctor that you are hypertensive, the doctor will say that you have to get your BP monitored for 5 to 7 days at like 3 times a day, maybe in the morning, then in the afternoon, and then in the evening. And if the constant values are more than 120/80, only then you are declared a hypertensive patient, right? In again, there are different symptoms which we can see in high blood pressure. Headaches, constant frontal headaches are a reason, and occipital headache as well, right? Sweating, nosebleeds are, you can say, a later symptom, right? Initially headaches, sweating, right? And then anxiety and confusion, right? Then which can lead to later as nosebleeds, and there can be heartaches. So these are the symptoms of high blood pressure. High blood pressure causes heart problems, right? Like as I told you, this is a sign, right? This is an alarm. If your blood pressure is high, means your heart muscles can be affected, right? Which can speed up your heart blockages. Then your kidney damage can be there, and then there can be brain paralysis, or brain can also be affected. So those were the symptoms of high BP. Now we are going to do for the low BP. Like in low BP, the patient feels that he or she is low, right? Like fatigued, body's fatigued, the patient weakness. The patient is not, or the person cannot stand, right? And what first aid we tell to that patient? Kya kar lo? We ask the patient to drink coffee, right? Sorry, I forgot. In high BP, you should restrict the salt content basically, right? You should not take high salt diets, like especially the junk food we are eating these days. Then you should always try to avoid papad, then sausages, any kind of sauce, chutney, all these have to be avoided, right? In high BP, but in low BP, this all is recommended. That you don't have to eat junk, but yes, you have to take caffeine, or you can take salt by eating salad and putting salt over it, raw salt. But in a high blood pressure patient, raw salt is very, very damaging, right? So then there can be fainting, blurred vision, stomach upset, fast and shallow breathing, and feeling tired, and confusion state. This is all low blood pressure. Now, how we can differentiate between a heart attack and a cardiac arrest, right? Whenever you approach a patient and you see that the person doesn't have a pulse, as I told you, that a patient, in an unresponsive patient, you have to check the carotid pulse, which is at the angle of the neck, right? If there is no pulse, immediately say that this is a cardiac arrest, and there is no breathing and the patient is not responsive, right? This means a cardiac arrest has occurred. But if you see a shallow pulse even, right, and breathing, and the patient is little bit responsive, this means it is a heart attack. Now, how to handle a heart attack? If you see that this is a patient of heart attack, you can immediately take any tablet. You might have heard of aspirin group, like Disprin, aspirin, sorbitrate. If you have any kind of such tablet available, just put it under the tongue of that patient, so that that will immediately lead to thinning of blood, and the blood flow will increase to the heart, right? So this will give a window time to that patient, and you can just take them and carry that patient to the doctor, and you can save a life. But in cardiac arrest, you have to give CPR. Now, how CPR is given, I'll just let you know. Now, CPR is cardiopulmonary resuscitation, that a person whose heart and lungs have stopped working, we have to recreate them and we have to restart them or resuscitate, which is cardiopulmonary resuscitation, right? We have to compress chest quickly and rhythmically. How we have to do this? That you have to stand towards the um, left side of the patient, and with the heel of the hand you have to give 30 compressions, right? 30 compressions in one cycle. You have to give two chest, which is push hard, push fast. You have to give two breaths and 30 compressions. Two breaths and 30 compressions makes one cycle for an adult, right? And you have to do four such cycles in 2 minutes. So your compressions have to be very, very fast, and you have to push them hard so that the chest goes around 1 to 1.5 inch inside. Now, adult we consider which are more than 8 years, right? Like this, you have to grab your hands and then you have to press. You have to give 100 to 120 beats per minute, and you have to give 30 compressions, right? And for a child which is 1 to 8 years, you just have to do it by one hand. And infant with who is less than 1 year of age, you have to press by just two fingers, right? And the chest should be 1.5 inches inside. If suppose this CPR is a manual technique, and AED, automated external defibrillator, is available, then what you have to do is just you have to turn on, right? And that AED always gives you prompts, right? You have to attach the two these stickers, one at the base of the heart, which is known as the fourth intercostal space, right? And one above it. So you have to put the electrodes, right? And first of all, whenever you're giving the shock, you should always see that nobody is touching the bed of the patient, right? And then you can press shock. Like this, you have to give till the person revives. Now, suppose sometimes when there is a heart attack, the patient might vomit, right? So what you have to do, you can put the patient in this position, which is known as recovery position. How you have to make it? It is very easy to make. If the person is lying supine or on the back, right, straight, what you have to do is you just have to put the right hand over the left cheek, right, and turn the left hand, right, and grab the right elbow and the right knee and just make it roll towards the other side, and this will prevent choking and open the airway, which is known as, this position is known as recovery position. In this, if a person is vomiting or in a case of drowning, right, this position is made so that whatever uh, excretions or sputum comes out of the mouth, they just drool out, right, automatically. So this is known as recovery position. Now, why the person has to be uh, turned to the left side? This is that the peristaltic movements, right? Peristaltic movements is an activity which takes place in the intestine, right? So these peristaltic activities, they get lesser on the left side. right? And they can be excreted by passing of the urine in the morning. And this will prevent any disease of the liver. Now that was a major topic which we covered is heart attack. Do you have any questions for that? I can answer a
Nothing.
few. Is that clear?
Yes.
Okay, so let's go to stroke. Now, stroke is another condition, right, in which like there is due to the any damage in the circulation of the blood or due to any hindrance, there is not proper circulation into our neurons or neurological system or our brain, which is known as stroke, right? Now, ischemic stroke is there and hemorrhagic stroke is there. Ischemic stroke occurs like suppose any hindrance or a thrombus is formed. Due to the clotting of blood, a clot is just like struck in the any vein or artery in the brain, and this is hindering the blood to flow to the next part. Now this will known as ischemic stroke, right? And hemorrhagic is when an artery or vessel due to high BP it ruptures and there is all bleeding into the head is known as hemorrhagic stroke, right? Now, this, if any kind of stroke occurs, either ischemic or hemorrhage, such symptoms can occur, right? Which is, we cover it under a suspect called FAST. F is for face. Face is drooped or eye is drooped, right? Which is like mainly paralytic attack, right? If we ask the patient to lift up the arm, they won't be able to lift, right? So A is for arms. S is for speech. Their speech will be slurred like this. If you like, my name is Neha, but if you ask me a question, what is your name? I won't be able to speak, right? So this is a slurred speech. And T is time, which is very critical in a stroke patient. If stroke occurs, we just have a window period of 20 minutes to carry that patient to a doctor, right? Because that can immediately lead to paralysis of the either of any side, either left or right of that patient, right? So if you see a drooped mouth and the patient is unable to lift the arms, slurred speech, immediately carry that patient to a doctor. So now next is we are going to do another major thing, that is shock, which is very like you can say common in summers here in India, which can lead to heat. We can also call it as heat exhaustion or heat stroke, right? In heat exhaustion, the patient will say dizziness, thirst, heavy sweating, nausea, and weakness can be there, right? And in heat stroke, like if a person is a laborer and working in under sun for like constantly for 6 or 7 hours, that can lead to heat stroke. So what first aid has to be done? Immediately take that person to a cool area, right? Give person ORS solution to drink. You can't give him one whole glass. You have to start with a small portion of ORS, means half a glass, right? Because if you will repeatedly give full, or the patient may get might vomit, right? So you have to give a small quantity of liquids, right? And you have to, if you think that the patient is not improving, just take that person to the doctor. Now, another important thing we are going to do is electrocution. Now, electrocution is a death which is caused by electric shock, right? Now, electric shock is like, suppose you accidentally touch some wire, right? Which is not, means which was not covered by your shoe or something, right? So electric current starts passing through your body. Now that is known as electrocution, and this will lead to electrical shock, burns, which are majorly electrical burns, and then there can be loss of muscle control, leading to thermal burns as well, right? So these are different kind of burns. A very important feature of an electrical burn is that always when there is an electrical burn, there will be an entry point and there will be an exit. When you can figure out a entry and an exit point, this means that the person is electrocuted, right? And there will be wires. Like suppose you are a trained first aider and you were just passing by and you just saw that somebody is falling on the road, right? So how you can see if the person has touched some wire or near a pole, you can always figure it out from the surroundings that the person might be electrocuted. So the first thing is you don't have to touch the patient, right? And you have to remove the wires with a wooden stick. Now, as a trained first aider, I should also tell you that your safety is of prime importance, right? First of all, only when you are safe, only then you are going to help that person, right? So you have to put your rubber, you must be putting your rubber shoes, gloves, and you should have a wooden stick in your hand. Only then you are going to help the electrocuted patient. And if you can figure out a entry and the exit point, this means that a person is electrocuted. In this case, you can't do anything because you don't have to put any water into it, right? Just bring the patient out of that area, right? And just transfer the patient to the doctor. You can just lift the legs, right? From 8 to 12 inches so that the blood circulation can be maintained. Now, there are different types of burns which can be due to heat, right? Now, there are three layers of our skin, that is epidermis, dermis, and hypodermis. When the first layer of the skin is burned, this is known as a first degree. If two layers are burned, that is second degree, and a third degree burn is when all the layers are burned. But now you cannot see like how you can see if first layer is burned, so it is first degree burn. Now you cannot just point it out by seeing the layers, right? So there are different types of signs and symptoms. When only redness is there, so that is a first degree burn, right? And you can put it under normal water, not cold water, tap running water, right? We always tell or we do the first aid, you can put ice or you can put cold water. No, the thing is because when your skin burns, the temperature of that skin rises, right? It is already increased. So you don't have to put cold water or icy water, because when two extremes of temperature will meet, that can lead to shock, right? So you have to put tap water on that area, right? Now, if you can see blisters, right? If there are blisters on the skin, means it is a second degree burn. And again, you can put tap running water. Then third degree, when all the layers are burned, such kind of whitish skin is appeared. So this is a third degree burn. It is mandatory that in third degree burn, you don't have to put water because the muscles, all the arteries, nerves, everything is exposed, right? So you just have to lift the legs up for 8 to 12 inches so that shock can be prevented and transfer the patient to the doctor. There are other kinds of burns like chemical burns. Now, again, in chemical burns, you have to be very, very careful. You cannot just put water, right? If you know that the person has come in contact with which chemical, then try to read the SOP of that chemical and use that antidote, right? Now, mostly water is like put in all the chemical burns. So you have to put water for 30 to 45 minutes in this case. Again, it has to be tap running water only. Then again, acid burns, again, they have to be dealt in the same way as I've told you. Read the SOP. And frostbite. This is like if you're staying in a temperature of above means -1 or -2 or in -40 like people stay in Canada and Saskatchewan, right? So frost bites occur. Now, if you are exposed to such kind of temperature, the first thing is that after every 15 minutes, you should move your body parts, right? Try to cover them. And inside your socks only or inside your gloves, always do the movements, right? Hold your joints and do the movements uh, so that the cold doesn't affect you and circulation continues in your body, right? So frostbite is when your body is exposed to much lower temperatures which your body can sustain. So this can lead to frostbite. Again, what you have to do is this is that you should move that patient to a warmer area and try to keep the patient warm and maintain the body temperature and try to maintain the circulation by giving proper warmth or heat. Cover the patient with quilts and blankets or means you can put on the heaters in a room and move that patient to the doctor if patient is exposed to very low temperatures, right? Another important topic is swallowed poison, right? Like suppose if a person has swallowed poison, then what we can always see if we are unaware what the person has taken, right? There can be nausea, vomiting, right? Abdominal cramps, drowsiness, dizziness. You have to just give that person plain water again for 10 to 20 minutes, right? Or gastric lavage has to be done in a case of a poison. You should never try to induce vomiting. If the patient is vomiting himself, then you have to put the patient in the recovery position, which I told you, right? Again, in the case of drowning also, you should put the patient in in recovery position. That is, you have to keep the right hand over the left cheek, lift the right leg, and uh, just turn your left arm and roll the patient towards the left side. Snake bites. All the snakes in this world are not poisonous, right? Only 90% snakes are non-poisonous and 10% of the snakes are poisonous, right? Now, the snake venom, they are they can affect our system by two things. That is, either it can be neurotoxic or it can be hemotoxic. And cytotoxic means that the venom affects our cells and tissues. Now, if a poison is taken, right? So if a snake is neurotoxic, then it is going to be cytotoxic as well. And if venom acts on your hemolytic system, then it will also act on your cells and tissues, right? Neurotoxic is nervous system when your brain is hampered, right? Paralysis occurs, immediate paralysis of your brain occurs. Hemotoxic is when it is pertaining to blood, heme, right? So we say no that get your hemoglobin done. So heme is related to blood, right? So this cobra and crate, they are neurotoxic, but vipers, these vipers, they are hemotoxic and cytotoxic. Now, sometimes you can also see from the uh, appearance of the snake that whether it will be poisonous or non-poisonous. Dark colored snakes with scales on the body, they are always poisonous, right? And the cobras, they raise their heads like this, they are poisonous. But non-poisonous snakes are usually light colored and without scales. Now, first of all, if you see a snake has bitten a person, do not panic, right? Make the victim lie down. Now, suppose mostly the snakes, they bite on the um, foot or legs. So what you have to do is, then you can hang the legs down, right? Never ask the patient to run or to walk, because that will increase the circulation and the venom will mix up more rapidly into the blood, right? So then you have to immediately seek medical attention. The previous, in the traditional era, we used to tell that cut the wound and enhance bleeding, but you don't have to do that. Do not try to suck the venom, or do not apply any ice or immerse the wound in water. You have to immediately transfer the victim to the doctor, and you have to just try that wherever the snake has bitten, that area should be kept away from the level of heart. Like legs, you have to drop down. If on arm, again, the arm has to be dropped down from a like from a chair or something, so that the circulation gets slower. Another important topic is seizure. When any abnormal activity, abnormal electrical activity occurs in our brain, that causes seizures. You might have uh, heard of Mirki ke daure in Hindi, right? Now, whenever there is such kind of seizures, this can even occur in children which are of small age due to high fever, right? Or there can be other kind of disturbances. Now, seizures, there can be numerous signs and symptoms of and reasons for seizures, right? But again, you should never try to control seizures. It will always be of a short span. So what you have to do is, the patient who is getting seizures might get injury, right? So always ask, let that patient lie down on the ground, right? And just move away the furniture and let that seizure episode happen. Never try to control movements. Don't put any mouth gags or spoon or anything in the mouth, because that will happen for a few seconds and will stop. If you can do, if the patient is like taking any medicine, you can, after the episode finishes, you can give the patient that medicine and take that victim to the doctor, right? So another very day-to-day topic is any kind of bleeding which occurs from wounds. The wounds are of different types. They are abrasions, lacerations, and avulsions, right? And amputations. Abrasion is where you can see on this leg a little of blood and discoloration of the skin. This is an abrasion, right? You can just wash it with water, and if you want, if you think that it is a bigger one, you can take a consultation of a doctor. Otherwise, it will automatically heal in 6 to 7 days. Laceration, laceration is cut and the skin is drifted apart, right? So you can put a bandage here after washing it properly under water and soap, right? Then this is avulsions. In this, you don't have to put water. You have to immediately consult a doctor. Now, for impaled objects, right? Now, suppose the, this person is a laborer and was working in a building, right? And this iron bars have impaled in the chest. So now you don't have to take them out, because taking them out can lead to profuse bleeding, right? But how you can move this patient? You can just make a ring pad of a bandage. Usually we keep triangular bandages in our first aid box, right? And then you can make a ring pad like this, and you can put it and fill it like till the end, and make the patient comfortable and move the patient to the doctor. Now, amputation. Amputation is cutting off a body part, right? If suppose a worker works in some like putting some hoarding, and the patient falls down on some sharp object, the finger might get amputated, or some there can be any amputation on the foot, right? So what you have to do, you never have to put that part directly into the eyes. You will take a poly bag, put that cut part into that poly bag, seal it. Then again you have to take a poly bag with ice, and that poly bag containing the part, you have to put it and seal it and rush to a doctor. So there are different types of bandages. When a simple bandage, like at home, we are using a circular turn bandage. Spiral is when you can make a figure of, like you can just in a circular fashion only, one after the other. That is a spiral. Reverse spiral. Figure of eight is very common because that helps in controlling the bleeding. Then there are jaw bandage and eyeball bandages, right? Fracture and splints. When there is breakage of a bone, right? That is known as a fracture. And for that, we use different kinds of supports or splints. Rigid splint is like this, that whenever suppose a leg is fractured, you can put a splint, tie it with a bandage and move to a doctor, because the area is very painful to move, right? And we don't have to increase the suffering of the patient. Just put the splint, which is can be wooden. Soft splint can be moved like when there is something in the chest, right? Like a pillow, or you can take a bed sheet, right? Make it with fold it, and you can put that soft splint. Anatomical is using the other body part. Like suppose in a case of this leg injury, there was no rigid splints or any kind of support. So what is done, that both the legs are tied and the patient is transferred, right? For broken ribs, we can use pillows and soft padding or bed sheets. Fracture is breakage of the bone, and sprain is tearing of the ligament. For everything, there is that these are the do's and don'ts. The do's are you have to immobilize the area by putting the splint, right? Add padding and check for circulation. But you don't have to move the broken limb, and you don't have to tie the bandage very, very tightly that it can hamper the circulation. For every kind of, you can say, fracture, sprain, strain, contusion, concussion, for everything, for any kind of like uh, in which ligaments, bones and muscles are included, this method is applied, which is known as rice. Rice is rest the part. I ice. Ice is put the ice pack on for 20 minutes and off for 20 minutes, right? Too much like thermal, this can lead to hamper of the circulation, right? So what you have to do is put 20 minutes on and 20 minutes off. Then you can compress and reduce the swelling and elevate that part from 6 to 10 inches. This will help in increasing the circulation. So the method is rise, rest, ice, compression, and elevation. Now choking. Choking is the total or the partial obstruction of the airway, which can caused by any foreign body. Like suppose you must have heard of a coin obstructed in a child's airway. So for that, we are doing a procedure which is known as Heimlich maneuver. What you have to do is put your thumb and make a fist, right? And stand behind the patient's back. You have to just tilt the patient forwards. Now feel the belly button and put your fist over the belly button, and the other grab the other hand like this shown in the picture from behind, and you have to give inward and upward thrust 5 times. This will put a pressure on the diaphragm, and the obstruction can be like just will come out with force from the mouth, right? Now this is with CPR in a small baby, right? Suppose milk gets obstructed, right? So you have to just with slightly with hands, you have to rub the back and open the mouth in the front. Now, if you're alone and something gets obstructed like a fish bone, so that is helpful. This is known as self first aid choking. This is, you can, with the help of the back of the chair, you can give yourself thrust, which are inward and upward, and you can take the thing out by a vomit. Now, for nosebleed, if there is nosebleed, the patient can be hypertensive. What you have to do is, you just have to, you can feel it on your nose. There is a bridge, right? Just below the bridge, there is a pressure point. Whenever there is the nosebleed patient, ask the patient to sit down, open the mouth and breathe from mouth. You don't have to breathe from your nose. Then with the help of your index finger and thumb, press the bridge of the nose for few seconds. The nosebleed will stop. But in the traditional times, what we used to do, we used to tilt your head backwards and put water. No, that will lead to formation of clots, and that can also go into your brain and lead to stroke, right? So for nosebleed, you have to ask the patient to calmly sit down on the chair, breathe from your mouth, don't sneeze, swallow, cough, or speak. Then you have to pinch at the bridge of the nose for 10 minutes. The bleeding will stop. So that's all. Thank you. If any questions, please ask. If any queries also, and you can also give your feedback.
Nothing, ma'am. Thank you.
Okay, thanks a lot.
If anyone has a question, he or she can ask this time. It's a very informative session. Thank you, Dr. Neha.
You're always welcome. Thank you.
You have done a wonderful job. That to deliver a maximum information in 1 hour is very critical and very difficult.
I tried my best.
But
I tried
yeah,
my best.
it is appreciated.
If anyone has a question, please ask. I'll help you out.
Anyone? No questions? Okay, Dr.
No,
Noah,
no,
so
thank
we
you.
can move on now.
Right. Thank you so much. Have a good day. Thank you.
Have a great day, everybody.
Thank you.
Thank you. Thank you, ma'am.
Thank you so much.
Thank you. Thank you. Okay, thank you.
Okay, thank you, ma'am.
Thank you.